Gender dysphoria is an experience of kind of distress, pain, dissonance, where the person experiences their body as kind of alien to them in a very fundamental way. So again, whereas for most of us, our relationship with genitalia might be kind of neutral, for people with gender dysphoria, to see their genitalia feels like they're looking at the wrong body. They ought to be the opposite sex and they're not.
Welcome back to the Truth and Fertility Podcast. I'm Haley Yeager. Today, I am sitting down with Dr. Julia Sadusky. She is an author, speaker, and a clinical psychologist that concentrates in sexuality and gender. And she is also Catholic, so she is coming from primarily a framework of Catholic anthropology. And so I'm really excited to pick your brain today because I don't think there's a whole lot of people out there that at least I would trust to talk about this specific topic, about gender, about sexuality. I think it's hard to find trusted sources on how do we address this conversation as Catholic with the lens of the Catholic Church, while still recognizing the realities of what people are going through in our world. So I'm really, thank you so much for being here today.
Yeah, thanks, Haley. It's so good to talk to you.
So why don't you go ahead, introduce your work, introduce yourself, your work, and I'm really interested to know why you chose to enter into this specific concentration.
So my name's Julia Sadusky. I'm a licensed psychologist in Colorado. I've been here since 2019, so I have a private practice where I see individuals and families and couples really around kind of a whole host of things. I mean, I'm a generalist psychologist, but I have a specialty in eating disorders. I have a specialty in sexual development and gender development. And so I do work with a lot of Christian families, Catholic families, where somebody in the family is navigating questions around sexual orientation or gender or their relationship with their body. And so I do a lot of work in that area. I've done a lot of research, some writing. I've written several books now on topics related to gender and sexuality and really trying to think, what does the average Christian, the average Catholic need to know to be effective in walking with real people or walking with teenagers or children who are navigating life on life's terms. And so that's a little bit of kind of my bio, my background. Went to Ave Maria University for undergrad. So that was really where I got a minor in theology and really grew in love for my Catholic faith and how that informs my understanding of sexuality and gender. And so that's a little bit about me. I would say to your question of how I got into this space or chose to do this work, to be honest with you, Haley, I didn't sit back and say, I'm going to do work in gender. I mean, I had people in my life in high school and college who were wrestling with questions around sexual orientation. So people who were attracted to the same sex and were trying to figure out what does it mean to glorify God and have that experience and to steward their sexuality in a way that honored God and was honest about their experience. So that was really the first, invitation, into understanding sexuality and sexual orientation was just the lived experiences of people I already loved. And I was learning about theology of the body at the time, and I was trying to kind of square church teaching with the experiences of people I cared about. And so that was the catalyst for really looking into who else is working in this area. And I came across the work of Mark Yarhouse, who's a Protestant Christian, a clinical psychologist who specializes in sexuality and gender. And so I went to Regent for my doctorate where I studied under him. And before I knew it, he had written a book called Understanding Gender Dysphoria. And I remember at the time I was doing youth ministry and I was getting questions as I was giving talks about sexual orientation. I was getting questions about gender. And I remember in a talk saying to somebody, I don't know enough about that to be able to weigh in. And this would have been my first year of grad school. And so very quickly in my second year, about half of my caseload was people navigating these questions around gender. And that was really because Mark Yarhouse was supervising my work. And so people wanted to be seen by his supervisee. And I became aware very quickly that most people don't have a ton of experience of walking with real people around gender. So I was kind of getting all of this understanding from just meeting with families. And so by the time I was in my internship year, which was my 5th year of getting my degree, Mark asked if I would write a book with him about gender. And that was our book, Emerging Gender Identities. And by that time, I'd done just a ton of clinical work with families, certainly done a good amount of youth ministry. And so I'd been seeing a lot of what a lot of people have seen, which is an increase in people sharing about these types of questions. And so I'm a people pleaser by nature. And so it is really difficult for me to square how I got into such a contentious area of the church and of the world. But I'm really grateful that really for me, it wasn't something I sat back and thought, let me get in the heat of the latest controversy. It kind of happened to me. And by the time I was being invited to speak and that kind of thing, I just had the hearts and minds of the families in my own mind. And so I was able to bring, I hope, a more personal kind of narrative of what that's like for people and less of the political kind of noise that we hear about this topic.
Yeah, I love that you say that you're a people pleaser too, because that is definitely me as well. And my whole message is to get girls off of birth control. So it's like when the Lord is asking you to do something, you just got to do it, right? You answer the call, and that's what's going to bring you joy. Even amongst wanting to please people when the thing that you're saying is not necessarily going to make people happy, but it's very necessary. So you talk about gender dysphoria. Can you define that? What does that mean? And how does it maybe differ from either same-sex attraction or LGBTQ plus? Can you kind of talk about those terms and how they differ?
Yeah, that's a great question. Well, maybe we'll start with the most broad and we'll get most specific. So LGBTQ or LGBTQ plus is kind of an umbrella term that's simply trying to capture the experiences of a group of people who have been marginalized or are different by virtue of their attraction patterns of who they're romantically attracted to, and or their experience of embodiment. So gender gets at my relationship with my body. So that's kind of the LGBT umbrella, is talking about the group of people who either or have a sexual orientation that's different than the majority, or a gender experience that's different than the majority experience. So that's LGBTQ. And then within that umbrella, of course, we're talking about two different things. One being, who am I attracted to? And that's a person who could be attracted to the opposite sex, attracted to the same sex, attracted to both sexes, not attracted to anybody, not experiencing romantic desire. And so that's sexual orientation. Who am I drawn to romantically, sexually, and relationally? And then gender, again, gets at our relationship with our body. So for most people, being born male or being born female is a fact. It's kind of not particularly noteworthy. Maybe there are challenges with masculinity and femininity and how we experience that in the world. Maybe there's conflict around our experience of our body. But the actual fact that I'm born a boy or born a girl is not particularly noteworthy, and it's not particularly challenging. But gender dysphoria is an experience of kind of distress, pain, dissonance, where the person experiences their body as kind of alien to them in a very fundamental way. So again, whereas for most of us, our relationship with genitalia might be kind of neutral, for people with gender dysphoria, to see their genitalia feels like they're looking at the wrong body. They ought to be the opposite sex and they're not. And so it might be good to analogize that a little bit. People with dysphoria have shared with me, it can be like doing a jigsaw puzzle at a table with other people, and everybody else's pieces are fitting nicely. And you're looking at your set and you're saying, how is it that the puzzle pieces fit so cleanly for you when they don't for me? Or if your listeners are musicians, it's like dissonance and music in your ear that never resolves. That could be what gender dysphoria feels like. Or a lingering upset stomach. Somebody said that you don't really know where it came from. You don't know how long it's going to last, but it's that sense that something is wrong. Something's really wrong, and I can't ignore it. It's kind of always there. And so that, I think, makes sense to me as a Catholic, because as Catholics, we believe that we are embodied everywhere we go. Not that we have a body, but we are embodied, and we're a body-soul unity. And so if I'm embodied everywhere I go, and it's not an accessory, it's kind of core to my sense of experience of the world, then when that relationship is feeling so fragmented or alien, that's deeply painful. And that would be the kind of psychological diagnosis of dysphoria, which again, you can explore gender, ask questions about gender, and not have dysphoria. But dysphoria is a very specific diagnosis that we use and for the people for whom the relationship with their body is really fraught, specifically because of being born male or being born female.
That's really helpful to make that those kind of the umbrella term and then having those two distinct experiences. So my first question, and I'm sure this is a question that you get a lot, but is nature and nurture. And so can we say that somebody is maybe born with either gender dysphoria or same-sex attraction or something different in their attraction, or is that more something that is brought on through nurture, maybe through a childhood experience or something like that? And I also kind of preface this question with the idea that our culture has really taken on this stance, this identity really strongly, even in the last 10 years, but really since the sexual revolution, it's kind of migrated into what we're seeing today. But it just seems that it's talked about so much more than it ever used to be. And so I'm curious to know, is it something that people are born with but are now just being more free, feeling more free to talk about? Or is this something that our culture is maybe nurturing into people?
Yeah, such a great question. And it is a common question. I think, the field of psychology, the medical field has invested a lot of time and a lot of energy in trying to understand what can be said about causal pathways for something as complex as who I'm attracted to, or my relationship with my body. And so there's been a pretty significant effort to look into causal paths. And the most we can say honestly as a field is we don't know what causes a person to experience attraction to the opposite sex, attraction to the same sex, conflict in the relationship with their sexed identity. We hypothesize based on the research we've seen that it's likely some combination of nature and nurture in every different person's experience. There could be different combinations of things that converge differently for different people. And certainly, there's been some interesting research done on organic or kind of biological pathways for these things. They have been widely inconclusive. So it wouldn't be as simple to say there's a gay gene, for instance, or a gene that makes a person have gender dysphoria or identify as transgender. But it also wouldn't be fair to say that it's merely a consequence of environment, that it's merely this solitary experience of, there's theories out there about parent-child relationships. There's theories out there about abuse and neglect. There's theories out there about environmental things like hormones and kind of drinking water. And so people have kind of pontificated about all kinds of possibilities. We really have no conclusive evidence in any direction that could be applied widely. I often use the analogy of if, you and I were meeting for coffee on the West Coast in California, I could guess how you got to California, but me knowing you're in California and you knowing I'm there doesn't say anything about how we both got there. And one of us could have taken the northern route and driven, the other could have flown over Arizona. I mean, there's a lot of ways to get to the West Coast from the East Coast. And by virtue of you being there, doesn't actually answer the question of how you got there. And so certainly in the gender domain, many people wonder how our current culture has contributed to the increase in people identifying in these ways. And I've met with people who I think would have had gender dysphoria at any other time in human history. They happen to be able to talk about it now more freely because they have language. I've met with older adults who would have looked in encyclopedias and libraries and tried to make sense of this when they were younger and they had no answers, and now they have language. I've also met with people who tell me that, they wouldn't have asked these questions at any other time in human history. And so again, even there's a lot of different pathways for this. And most people are interested in causation, Haley, simply because they think if we can figure out the causal path, we can help tweak some of these things. So some people wonder, if I know what caused my experience of attraction, could I change it in some way, especially if it was an environmental cause, right? And again, what we know from research is these are pretty stable experiences for many people, specifically in the realm of sexual orientation. So who I'm attracted to, if it persists over time, it tends to be pretty stable over the lifespan. Gender is a little more complicated. There's kind of critical times in life where there's kind of exploration of that, and that may evolve in a lot of directions. But if you hit adulthood and you've had a pretty stable conflict around gender from a very young age, like 3 to 5, and you're 20 or 30 and you're still experiencing that, it's very likely that that's going to persist over your life. And so it's more about, how do I manage that conflict? How do I manage the distress? How do I cope with the pain? As opposed to how to get rid of this. And so that's always disappointing for people, I think, when I share it, because a lot of people are really interested in causal paths. And I'm much more interested in where people find themselves today and what do I do with this experience? How do I steward it in a way that honors God and honors other people, honors myself? So yeah, it's
Yeah.
a long answer.
Yeah. No, that was great. And actually, I want to ask you too, as a psychologist, when you are working with patients who struggle either in same-sex attraction or gender dysphoria, how do you typically address that right then and there? Is it something that you're looking for in their background? Like maybe this started with something environmental, or are you meeting them where, I'm sure you're meeting them where they're at right then, but what are you first addressing with that person?
Yeah, so my approach is, again, pretty different from kind of trying to paint causal paths, specifically in the realm of sexual orientation. So something I try to do is I work in a kind of narrative way. So understanding the story of somebody's kind of how you got here. So if they have a sense of like, this is when I first experienced attraction, tell me about what that was like for you. How did you make sense of that at the time? What words did you use to talk about that? Who knew? Who did you share that with? These kind of common milestones that people hit. What was it like when you shared with your mom or your cousin about your attraction, with a priest or, with a youth minister? Like, what was that experience like? How did they respond? How did that impact you? Like, what was that like for you at the time? And we have all kinds of research on the type of milestones people hit. And so I always ask about those milestone events. Did you have any relationships romantically with the opposite sex, with the same sex? What was that like for you? So you're just kind of mapping with people how they got to where they are. What language do they use to talk about this today? What's been helpful about that language? Is there anything about the language they don't love? And how do they communicate with other people? So it's a lot of just mapping the story of how they got there. And it would be the same with gender, trying to understand, for some people, like I mentioned, their gender distress starts very young. Because if you're around children ever, you know that between the ages of 3 or 5, they start to notice they're a boy or a girl. Well, if you have gender dysphoria at that time, you don't notice that you're a boy or a girl. You look at that and say, no, I'm really this. I'm really the opposite sex. And so again, for some people, that starts very young. So we're understanding, what was that like? Who did they tell? Who noticed? How did people respond? And then mapping that all the way through puberty, because puberty is another critical phase where people can experience this. So again, not so much trying to pull out a magnifying glass and kind of figure out how they got there, because we don't have good evidence from research that any one causal path is really entirely relevant. It's more looking at kind of the guideposts along the way and then prioritizing treating mental health concerns. So remember, I'm a psychologist. People come to me usually because they have depression, anxiety, self-harm, suicidality, an eating disorder, trauma, other things that they want to address in therapy. So I use all kinds of evidence-based protocols to treat those things, accounting for gender and how that kind of may impact things, accounting for, their experience of all kinds of things, including faith, sexuality, other things that are important to know about their experience of the world.
In your experience with your patients, is it common for patients to come to you saying, I am experiencing this either unwanted attraction or unwanted desire to be the opposite sex? Help me fix that? Or is it more so, in your experience, seeing patients that are just struggling with how to integrate that into maybe they are Catholic or Christian and trying to integrate that into a life of faith, or do you see both? I'm sure you see both, but what is the typical disposition of the person that you're seeing?
Yeah, so increasingly, I mentioned the research on changing these things, kind of showing there's a lot of stability in these experiences. And so I used to hear from more people who were curious about changing attraction or even framing it as kind of unwanted same-sex attraction. I don't hear as much of that because I think I hear some of that. Some people come to me hoping for that. And then I'm really educating them of what we know in the field from research, from the evidence we have about the likelihood that would change for people over time. And then my approach is more of the latter, what you mentioned, which is helping people integrate these aspects of their experience in ways that honor their values. So what are your beliefs and values around sexual behavior? What are your beliefs and values around your relationship with embodiment? What do you want that to be like based on your faith, based on your commitments? Like, sometimes people come to me and they have dysphoria and they're married and they're married to somebody of the opposite sex. And it's really important to them that they remain married to that person. And so they may make different decisions than another person would make as far as how they cope with gender distress. And so, again, it's more about integrating this. And once I help people understand that the goal I set is really not about attraction change at all. I'm not particularly interested in that. I also don't have a protocol that works for that. We don't have evidence that protocols change a person's attraction or identity. And so I teach people that, and then I often notice a lot of relief in people because once they can kind of grieve maybe what they hoped for when it came to that, they can figure out, so how do I live? How do I move in the world today? And it keeps people from living in the rearview mirror where they're trying to trace how they got here. And they're more interested in how do I glorify God with my life today? And I see that being very life-giving and relieving for families in figuring out how to do that well.
What does that integration look like then on a practical level? And with that being said, for the patient that you're working with, integrating that into their life, what does that look like? But then also on the flip side of the coin, how can people of faith respond to rightfully and in a loving, charitable, integrative way to folks that are struggling with this?
Yeah. So one of the first things is, in Christian communities and Catholic communities, sometimes we can just not acknowledge these experiences at all, right? If we acknowledge them, we might acknowledge them in a political way, like the LGBT community out there in the world. And it can send the message to especially young people with these experiences that the group of people with these experiences are kind of outside of the church. So one aspect of integration is kind of saying, wait, let me kind of learn about this experience. That's why I ask about the milestones. People being able to kind of hold in their hand and hold out this experience and talk about it freely with other people and find language to kind of communicate it to people they love and ask hard questions about, what does it mean for my faith? What does it mean for my relationships? What are my values around sexual behavior in the realm of attraction? All of those questions are integrating of this experience. So you're not holding it at arm's length. You're not pretending it's not there. You're kind of drawing it close. And many people worry about that, to be honest, at first. Like, if I bring this close, if I take it out of the closet and sit next to it and hear from it, what will happen to me? Will I become totally defined by it? And I don't know about you, but in my own experience of exploring who am I, that involves drawing close to my experiences. And actually, the more I try to push them away, the more they take up space in the room. The more I pull them close and say, okay, tell me all about it, the more different aspects of my experience and identity become part of me that I can talk about freely. And so that's one piece of it, I think. Another practical kind of how does that play out, I think, is, really figuring out how to approach God with these experiences. A lot of people feel like if they have questions around sexuality or gender, that precludes them from a relationship with God. They kind of have to leave the church, figure it out, and then come back when they're got it all sorted. And so I think a lot of my hope for clients who are people of faith is that they can learn in community and safe kind of pockets of safety is what I talk about. Like, who are the core people, who's in my corner, who can receive these parts of me and who's not reducing me to them, but also isn't ignoring them and saying, hey, you can't talk about that here, because so much of that reflects the heart of God. And my experience of God in prayer is that he says, tell me all about it. Tell me all the things. And he doesn't tell me you have to use this word and not that word. And so I think practically in our churches, if we can move beyond debates about language, if we can ask good questions of somebody, what does it mean to you when you use that word? What's helpful about that word? Is there anything about that word you don't like? To help people distinguish how they use language of, let's say, the word same-sex attracted or gay or lesbian or bisexual or gender dysphoria. What about that word is helpful? Why are they using it? And honoring that language and saying, okay, what does it mean to you? Some people use it to say this is all that they are, the most important part. Other people, it's simply an adjective. Like I say psychologist, and it's not the only thing or even the most important thing, but it's hugely, influential in my experience of the world. And so helping expand our sense by talking with the real people who have these experiences. I've learned a lot that way as a Catholic and as a psychologist as well.
Yeah. What ways, besides language, because I know language is incredibly important when talking about this topic, but what are some other ways do you think that Catholics or just people of faith have really missed the mark in addressing this? And in what ways can we better address it? Besides, of course, meeting the human being person that is in front of you and just getting to know them and getting to know their story and loving them, because that is exactly what Jesus does in the Gospels, is he sits with the people that are struggling and he talks to them and he loves them and he looks at them in the eye. I think I think people of faith can be still very afraid of this topic because we just don't know how to reconcile it. And that that's also my question for you is really, how do we address this better? And maybe how have we missed the mark in the past? How can we address this better and really reconcile it even in our own brains of really learning how to love and how to love the person that's struggling with this?
Yeah, well, you mentioned fear, and I think fear, when I'm afraid, I don't bring my best self to a relationship or a conversation. And when we're afraid, in psychology, we talk about defense mechanisms, right? The things that we use to cope with fear. And so what are those things that we've done in the past that I think well-meaning people have done because they're afraid and they're trying to grasp to something? Well, we intellectualize it, right? We think in terms of causal theories and we say, let's figure out how we got here. And that feels really effective on some level because I'm wrapping my mind around it, right? But the question becomes, does that really help? Or does that just defend against my own fear of the unknown here? The fact that we really don't know what causes something as complex as an orientation in any type of consistent way. So I think the intellectualizing has been kind of part of that. Another way that plays out is cognitive disputation, to trying to argue about theories with people. So when somebody comes to a parent and says, hey, like I feel like a boy, sometimes parents say, listen, I was there at birth, you're a girl. Let's look at your chromosomes are this. Like we go cognitive disputation. And it's kind of like what we can do with other things. Let's take depression, where somebody's feeling, let's say, suicidal and like their life doesn't have meaning. If you come at them and say, well, God loves you. He made you with a purpose. He has a plan. That's maybe true. Does that treat their depression? No. In fact, what it does is it often makes people feel stupid, like more lack of belonging. Like, what's wrong with me that I can't see what's obviously true? And so it compounds shame, the cognitive disputation. Because if it was just that simple, right, then nobody would come to therapy for it. That would be all that was needed. And so I think that's been unhelpful. I think politicizing the conversation has increased fear. I think gender has become a talking point in politics today. And there's reasons for that. I mean, there are socio-political implications of all this that are worth attending to. But those are not worth attending to at the dinner table with your 14-year-old. And they're not worth attending to when you're sitting across from a real person who's 60, who's been navigating this for a long time, and has had a conversion and wants to be baptized Catholic, right? Like the political is not the personal. And I think being able to distinguish that and distinguish the fears that we have about the political is really key. Um, and then I guess finally, I'll say for now that, I think a lot of well-meaning Catholics um, do feel like these questions challenge anthropology in a fundamental way. That if you concede that a person could have this fundamental schism in their sense of self around gender, for instance, you're kind of denying norms of sex and gender. And it's been my experience in working with real people with gender dysphoria that very few of them challenge the binary. Now, I know there's political conversation about the binary that plays out in all kinds of ways, but people with dysphoria live within a binary. They're trying to figure out how is it that I'm born male and I'm experiencing myself as female. So there's no question about human anthropology that they're pushing back on. They're really trying to contend with the fact that they are born male or female, and that's a fact. They don't question that fact. They're just trying to say, well, how do I live in a world where my body signals one thing and my mind or my heart experiences this very differently than most people.
So what is the resolve for that? Because of course our culture is saying, well, take hormones and change your gender.
Mhm.
And we of course know that that is very destructive and dangerous. And so what would the proper resolve for somebody who is experiencing gender dysphoria, what does that look like for them?
Yeah, but
In a healthy way, of course.
that would vary person to person. Gender dysphoria is kind of like any other mental health concern where it can be more or less severe person to person. So you could have severe depression, you could have mild depression. And so for one person with dysphoria, I've met with people who are Catholic who have dysphoria, who it works really well to, as a female, keep their hair short because that kind of helps with when they look in the mirror, it's just like more congruent with what they would expect to see. So they keep a short haircut or they dress in such a way that's a bit more androgynous, that's not leaning into kind of hyper feminine or hyper masculine presentation, but just kind of finding clothing that suits their body and makes this not as much a front and center focus of their mind so they can go to school or go to work. Um, there's all kinds of coping skills that we use for all kinds of pain. And so helping people cope with the pain of, for instance, menstruation if they're female, um, helping people learn about their body so that they can know, okay, what's the purpose of this thing that I hate that's happening that feels like it's making my body feel more chaotic than it already feels. And so kind of education is helpful for people about what the body's doing that for. Sometimes it is, helping people kind of use adaptive coping skills in a nickname. So kind of finding a name that's not as hyper masculine or hyper feminine that they can go by so that they're not as fixated on gender when somebody's talking to them. And then certainly, I've met with people who have pursued things like hormones and surgeries after decades of feeling like, nothing else was making life sustainable for them. And, I don't kind of widely endorse those things as kind of good things for people to do, and certainly wouldn't say that the cultural norm of just going that route right away is wise for people. But I've walked with people who have sought out those things when they really felt like there was not another way forward to maintain a life with these really severe cases of dysphoria. So I've witnessed that as well. And I think the Catholics I've met with who have done that will be honest and say to me, I don't know that I did the best thing morally there, but I didn't feel like I had another option from a mental health perspective. And there's no established treatment protocols that resolve dysphoria. And so people are really doing often the best they can with what they have here in a world where we don't have the best resources. We don't know enough, I think, to be able to really address this psychologically in a sustainable way in those severe cases. So I feel a lot of compassion for people who have pursued hormones and surgeries. Those are the available treatments for them. There's not a lot of available treatment otherwise. So I talk about adaptive coping. I talk about plateauing versus mountaintop experiences in our culture. It's kind of like the hormones and surgeries are the mountaintop experiences that everybody's going to get to. And those are challenging decisions, and they have implications on people's physical health and well-being over time. So they're not cavalier. They ought not be treated cavalierly. So I talk more of, as you're hiking a mountain, what are the plateaus that you find along the way? And recognizing for some people, it ends up feeling like the only pathway that will work to maintain any kind of semblance of life. And so I don't think there's enough we know about all of this to really, do more than what I've just said as far as right now.
I'm really glad I'm learning about this from you right now, because I'd never really thought about gender dysphoria being something. Of course, it's something that somebody can experience, but really it being on the forefront of their mind all the time, and changing their hair or changing their clothes or changing their name. Now, at least for me, I think of it as a political stunt.
Correct.
But in reality, they're trying to cope with this struggle that is in the forefront of their brain at all times. And that, I think, just even realizing that, I mean, even just in the last couple minutes, I've just gained so much more compassion for these people that are experiencing this. Now, I said earlier, and I kind of made a blanket statement of like, of course, surgery would be destructive, right? As a Catholic, what should we say about transgender surgery? Because now, especially, I feel like I'm having this awakening right now, just recognizing the real struggle that people are going through and trying to figure out how to live a normal life and integrate this. Is surgery ever a morally okay option for somebody that really is on has a severe case of gender dysphoria? As a Catholic, can we ever suggest that as an option?
So certainly Catholics will weigh in on this, and as a Catholic person, who has no teaching authority in the church, I could offer perspective on that. What I try to do as a Catholic is I look to what the church has given us. So the Catechism has a point where it talks about genital mutilation or mutilation in general, and it says, unless it's for strictly therapeutic medical reasons, it would be morally problematic. And so I think the bar is pretty high there as far as what are kind of strictly therapeutic reasons. Now, certainly I could imagine, now the church hasn't given us all of this, but I could imagine a scenario where, and I've seen and witnessed scenarios where it seems very clear to me that a person is pursuing a surgical intervention solely because they have this mental health diagnosis that is unrelenting, and they're trying to cope. And so I think that's where people go in their discernment is if I'm doing this to cope with this severe mental health concern, is there latitude for that in the heart of God, who knows from the inside what this is like for me? And so that's how I've seen people discern that. I wouldn't say the church has given us a very clear rubric for how to discern that. Although there's been some reflections on the principle of double effect. Could you do something that is kind of disordered in some way for the greater good of the whole body? Could you remove a part for the sake of the whole? Is a kind of discernment point. And then we did have a recent document on the dignity of the person, Dignitas Infinita, that weighed on this as well. And it said, gender change and interventions or that kind of thing risk threatening the dignity of the human person, usually, but not always. It said they, as a rule, risk threatening the dignity, which if you hear that language, when I hear it, it's kind of caveat language. It says usually, but not always. Well, my mind goes to what's the not always, because I'm working with these people. And we haven't gotten language from the church on that piece. What we've gotten is that these are grave concerns. These are not to be treated cavalierly. They usually, but not always, risk threatening the dignity. That doesn't even mean they always usually threaten the dignity or violate the dignity. It's like there's just a lot of nuance in that language given by the church. And so I think that's like a lot of moral concerns, actually, is that the role of discernment with spiritual directors and pastors and through the sacramental life of the church is required for people. So I'm always trying to encourage the people I walk with who are Christians and Catholics to turn to those spiritual resources in a personal context that help them discern these things in really real ways. I would say, again, as Catholics in general, I think we ought to be cautious about these types of interventions. We have to recognize they're not merely changing people's essence in a fundamental way. They are trying to help people cope, in some cases, with enduring concerns. And I appreciate what you just modeled there as far as kind of thinking of this and saying, whoa, what would that be like? It's been my experience that most people with this experience have no interest in wreaking havoc in our culture. They're just trying to survive. They have to go to the bathroom somewhere. So is there a family bathroom? They have to kind of go to the bathroom and they don't want to have to think every time they go in the bathroom, about all these things. So is there a place they can go that's not next to a bunch of other people who they feel at odds with? And for you and I, we go to the bathroom and we don't think about that. And so it's cavalier to say, well, why can't you just go to the bathroom like we do? Well, it's been striking to me how much that taxes people to be constantly reminded of this experience by the way our world is naturally split, right, in terms of these norms, which makes sense and is taxing, I would say, for people with these experiences.
Yeah. Now, talking about gender dysphoria, and I know you said that was kind of separate from the attraction piece, but at least from what I'm seeing in our culture, I think they are very intertwined.
Mm-hmm.
What would, and I know this must be, this can't be a blanket statement, I recognize, because you even gave an example of a married person who
Mm-hmm.
later on either recognized or had at least admitted that they had gender dysphoria,
Yeah.
but they want to stay married. And so, there's a reconciliation that needs to happen there, an integrativeness that needs to happen there. But I'd say, for the general person, maybe they're struggling with same-sex attraction with or without the gender dysphoria attachment there or attached to that. What would chastity and living a life of faith that's fully integrated, like in the framework of Catholic anthropology, what would that look like for them? Are they in general just called singleness? Like what does that look like?
That's a great question. Yeah. Certainly, again, I always try to go to the catechism and to kind of like, what does our church say? Because a lot of people right now are weighing in on this and they're telling us what the church says, but they're not
Yeah.
always using the language of the church. So,
Yeah.
so the catechism talks about the reality that people with these experiences are not negligible, meaning numerically not negligible. And they talk about the fact that people with these experiences are called to the heights of Christian perfection. That's the language of the third paragraph of the Catechism on homosexuality. And they talk about friendship. They talk about sacramental life of the church. They talk about prayer. They talk about service. Like there's all kinds of ways that people glorify God. And they talk about the fact that same-sex sexual behavior is not God's best for people. And so all of that adds a bit of a framework for Catholics, I think, who are experiencing same-sex sexuality. Now, the thing of it is, the Catechism also says that self-mastery is a lifelong, exacting work. And it requires community support, and it requires friendship, and it requires a lot of things that a lot of people do not have when they're navigating these experiences. And I think God is fully aware of the barriers and blocks that exist in cultivating virtue in the world today. And so I think for me, when I talk about chastity, I think sometimes when people hear the word chastity, they think of a point of arrival, a point of perfection. So chastity is singleness, and it's refraining from sexual activity, and it's not masturbating, and it's not, right, hooking up, and it's all these things. And virtue is all of those things, right? And we don't actually treat any other virtue as a point of arrival. When we talk about justice, temperance, prudence, we're not vetting a person's Catholicity based on how perfect they are at those things. And so I want to be clear that the church, yes, gives an invitation to gay and same-sex attracted people to steward their sexuality through whether it's singleness, if they're married heterosexually, it's being faithful to their spouse to the best of their ability. If they're clergy, if they're a priest or religious, it's learning how to engage in friendship and prayer and community in ways that honor God and honor other people's dignities. If they have crushes on people, it's learning how to talk about those crushes with safe people so that they don't come out sideways and acting out. And most people in the world, if we're honest, fall short of God's best for us in sexuality to one extent or another at varying points in our lives. And so what I don't want to do is apply a higher standard of perfection to same-sex attracted people than the rest of everybody, where we look at them and say, if you fall short of God's best, if you're sexually active with somebody of the same sex, if you masturbate, if you view pornography, we're going to gauge your Catholicity based on that. We really don't tend to do that across the board. And so I want to temper that. People fall short of God's best. God's best is refraining from sexual activity outside of marriage. And the framework for marriage is heterosexual marriage in our Catholic faith. And so for heterosexual people and same-sex attracted people, to whatever extent sexual activity is happening outside of that, we would say it's not God's best. And the question becomes, how do we walk with one another in the reality of what that looks like, which for most people is a lifelong exacting work, as the Catechism says, not a point of arrival at 15 or 20 or 30 or even 60. So I think we can do a better job earlier in cultivating conversations around sexuality with young kids and teenagers so that those who find themselves with same-sex attraction don't have shame about it, so they can openly say, hey, I'm noticing this. Whoa. And they can talk about that, and they can talk about what it is to steward that, what it is to have friendship, what it is to cope with when I'm drawn to somebody sexually and romantically. What do I do about that? Do I have effectiveness there? When I stumble across pornography, who can I talk to about that can actually practically help me, not just say, stop it, that's a mortal sin. Like, I don't think we've had and built the structures that cultivate chastity in a sustainable way for most people, actually, in the practicals. And so I'm really interested, and have been for a while now, in what are the skills that we need to give young people before these things kind of unfold, so that by the time they do, they've got a lot in their toolkit to really help make it more possible.
Yeah. And that is incredibly helpful. And just recognizing the universal call to chastity, and that chastity is a virtue just as any other virtue, and that it's a habitual gain, right? It's not something that we just have. It's something we practice, and we fall and we climb back up, and so I really like that you put it in that context. Now, I'm curious, as a psychologist who has this view of, specifically, of course, a Catholic view of gender dysphoria, of same-sex attraction, how do you practice differently than any other psychologist would in this case? How would you address somebody who's going through this experience differently than any normal mainstream psychologist? And kind of added to that is and I don't know if this is true, but I've just heard of things of where legally there are things that you can and can't do, or can and can't say with somebody who's struggling with this. So can you go into that a little bit of how you practice differently, and are there any legal issues with that as well?
Yeah, that's a great question. So I would say a lot of what I do as a psychologist is exactly the same as a secular psychologist. In fact, I often tell people, if you find a competent secular psychologist, I would take them any day. I'd go see a secular psychologist. They do a lot of good work. Some are biased. You got to look out for biases. So if somebody's pushing you in a direction you don't feel comfortable, of course, don't meet with them. But that's true for Catholics too. We can have biases and push people in ways that are not helpful. And so I think the goal is competence. So in some sense, what I do is exactly what another person would do. where I'm asking good questions. I'm hearing people's stories. I should be asking about their values. I think by virtue of being a person of faith, there's some evidence to show that people of faith who are therapists ask better questions about spirituality. We attend to that. We see that as an aspect of identity that's relevant to therapy, relevant to mental health. So if I'm talking about how to cope with anxiety, for instance, and I know a person's a Christian, I'm going to bring in interventions sometimes that are infused with scripture or faith or kind of reflections and prayer that can help them with coping, right? So there is an attention to the spiritual, taking it seriously, that I think comes up a lot as a Catholic psychologist. I think another thing is secular providers sometimes have biases against abstaining from sexual activity for any numbers of reasons, or maybe if a person's married, might have more of a cavalier sense about marriage. And so there's ways in which, as a Catholic, I can hold those value conflicts for people, like that sexual activity can be a point of concern for somebody. Masturbation could be a value conflict for somebody, and I can honor that instead of just simply normalizing those behaviors as such and saying, what's the big deal? And then I would say that you asked about the legal domain. Now, I probably have a different perspective on this than a lot of Catholic therapists today, because the approach that I developed with Mark Yarhouse around gender, the therapy approach, is thought of pretty highly by secular people, because the whole point of it is not changing attraction. It's not changing identity. It's about helping people honor their beliefs and values and honor their experience and integrate them. And the laws that exist around all of the therapy for sexual orientation and gender is really targeting efforts to change attraction or to change identity. So many secular people are very concerned about a therapist coming in with an agenda and saying, hey, person with dysphoria, at the end of therapy, I'm going to help you identify with your biological sex, even though I don't have a treatment protocol that's evidence-based to do that. Well, I'll help you with faulty parent-child relationships, and maybe that'll help. Or I'll help you with your trauma, and maybe that will help. Well, the secular field has really cautioned us from offering those kinds of promises to people implicitly or explicitly. And I think there's reason to be cautious, to be honest. And I think the laws are trying to protect vulnerable people from promises that are rarely delivered on. And so I like that those laws exist. I don't believe that they prescribe any language for me. They don't tell me I have to be pro-gay marriage. They don't tell me I have to be pro-medical transition. They tell me that I can't promise attraction change or identity change through therapy. So that's often misunderstood. There was a Supreme Court case this year about that ruled in favor of a therapist who disagrees with me on that. And so, I want to be honest that this is pretty fraught terrain, but I've worked in a state that had a ban on efforts to change orientation since I got here, Colorado, and I've never had issues in my work with people. And I've even met with the Attorney General's office here and shared with them my approach, and they've been very excited about the fact that it exists to help people of faith honor their values, actually. And they'll say to me, I love that you help people if they don't want to watch pornography, not watch pornography. Just don't tell them it'll change their attraction. I love that you help people refrain from sexual activity if that's important to them. But don't tell them it's going to change their attraction. And, I love that you treat trauma, but don't tell them that's going to change their attraction. And I've been really edified by conversations with people who disagree with me on a lot of things, who really value the work that I'm doing. And I think sometimes clinicians are not well trained in all of this. They just don't have the formation or the access. And so there's a lot of fear, to your point earlier. And that fear can create a bit of a vacuum for us, and kind of believing that we can't do good work in this area because of the laws that exist. I think we can. I think we ought to. And again, I think there's nuances to what I bring, but I don't like to use my faith as a marketing strategy, I guess we'll say. So I try to be honest that a lot of what I do is hopefully what every other secular therapist does, but I think my attunement to beliefs in spirituality and respect for those ought to be really front and center in the work that I do.
Yeah. I really appreciate your perspective on that too, because as you said, there's no protocol on how to change somebody's attraction, but you can still heal any trauma that's been experienced. You can still heal, you can work through the depression, you work through the anxiety, the things that are accompanying that. Now, have you ever seen somebody actually end up changing their attraction after working through either the trauma or mental health issues that they're experiencing? Has it ever changed somebody's attraction?
Yeah, it's a good question. So when people ask about change, usually they're thinking in terms of a light switch, or like you turn off this light and on this light. So if by change we mean an absence of attraction to the same sex and the presence of attraction to the opposite sex, I've never witnessed that categorical shift. What I have witnessed is fluidity. So there's tons of research in the secular field and also among Christians of sexual fluidity, meaning attraction ebbs and flows over time. And actually, more for women than for men. More women report some level of attraction to the same sex at some point in their life. I think it's like 20% or something as high as that. And so that tells us something, right? That certainly I've seen clients of mine who came to me and they were at that time exclusively attracted to the same sex. And over the course of therapy, and I don't even know that it's because of what happened in therapy. It may have been time, life. They experienced attraction to a person of the opposite sex. Those individuals, of which there are only a few, also continued to experience attraction to the same sex. They just happened to stay in a relationship where they're very happy with somebody of the opposite sex. So I have seen that happen, fluidity over time. I've also seen the opposite, heterosexually attracted people who at some point develop a crush on somebody of the same sex. Is that because of therapy? I don't think so. I think they experienced attraction over time. In the realm of gender, it is a little more complicated. So most people with gender distress in childhood don't identify as trans in adulthood, actually. Most of them eventually identify as gay, lesbian, or bisexual. That's what we know from some line of research we have there. And so there's something developmental around figuring out my sense of gender. And so I've seen more people in the gender domain make all kinds of decisions, right? Like people who came to me and had gender distress, and then by the end of therapy, that distress has been kind of alleviated in some ways, or they don't experience it anymore for any number of reasons. And I've seen just as many people who come to me and identify as transgender and still identify as transgender after treating all the things, including their trauma. And so there's a lot of pathways for how that plays out, but I don't have an intervention that changes it. And I don't claim to, because I've seen that do such harm to people. It feeds off a hope and a wish that this would go away. And I think it exploits people's hopes when we promise these things that most often don't happen. And if they do happen, we don't know how they happen. And so it's been very rare that I've seen, oh, because we did this, that happened. I could give you probably 50 different pathways for this, and sometimes you don't see the same thing twice. So these are rare experiences when we're talking about gender. They're not common. And we don't really know enough to say much with confidence. And I'm a specialist who's done this for over a decade. So I think anytime I hear people make confident claims of it's this or it's that, and here's how you treat it, and here's what we know, I'm just skeptical. And I try to look to trustworthy sources to help me vet some of the confidence that exists today about all this. In any direction, by the way. Yeah.
Yeah. This has been extremely informative, at least for me. I'm sure for the listeners too. And I feel like I could ask you 50 million more questions, but for the sake of time, if somebody is experiencing this, or maybe they have a loved one that's experiencing this and are really wanting to help, what are some resources that either you have or that you trust that they can go to?
Yeah, so we can put in the show notes my website, juliasadusky.com. It has all my books. Emerging Gender Identities is a book for family members, loved ones, and people navigating gender questions. What does the average Christian need to know to walk effectively with people? Emerging Sexual Identities is a new book that Mark and I came out with, really talking about sexual orientation today and how there's all these expanding labels around asexuality and different sexual attractions. And so how do we think of that as Christians? How do we engage queer theory if that's interesting to people? Mark Durhouse is an expert in this who has written a ton for Christian parents when a loved one comes out. I've written a 2-book series for Catholic parents in particular on sexual formation and education. I've really loved those resources and been excited to see the ripple effects of them. So if you have young kids, start talking to your kids about sex is a great option as a book. And there's a teen book. And then finally, there's a video series I just rolled out for Catholic parents on sex education for teens. And it's really taking the key concepts from that book, talking with your teen about sex and trying to make it accessible for parents. And it's a really good option for parent small groups to talk through in kind of a module series of, 7 to 12 minute video clips that are just me kind of sharing the key concepts from that book and giving a lot of handouts and resources and worksheets for parents to use with their teens. So really excited about that. I'll make sure you have a discount code for that video series if people are interested as well.
Is that on your website as well?
So it actually has its own landing page. So I'll send you that for that, and then I'll make a unique code for your listeners.
Okay, awesome. And I also know you have an Instagram too, because that's how I first came across you.
That's true.
And you have a lot of informative stuff on there as well.
Yeah,
so
that's a good reminder. Yes, I forget about that. But yeah, the Instagram is probably the best way to follow what I'm thinking about day to day.
Awesome. Well, thank you so much for your time and being on the podcast today.
Yeah, Haley, it's been so fun.